I think we're kind of ready to go, really. Yeah, let me just kind of briefly introduce myself. My name is Ripon Ray. I've set up Britbanglacovid. It started in April, just at the beginning of the lockdown. And it started because I think personally, I felt something wasn't quite right, in a sense of, and I sensed there will be chaos and tragedies ahead, although I didn't realize at that time to what extent and on what scale. So started in early April, having had a conversation with a few of my colleagues. Many of my colleagues are here actually as we speak, and the stories I was getting were not very positive. I was hearing people losing their lives. I was hearing fellow colleagues losing their jobs, and of course, a number of other things really. So the way I wanted to capture the stories of those individuals whose stories have not been told, I've decided to kind of set up Britbanglacovid. And on that side, you can see lots of stories on podcasts, YouTube, blogs, really around individual stories. And as time went on, stories were getting too many to handle, really. So to kind of like organize the thought of Britbanglacovid, we then had a survey which has been published and sent all over London, as well as taking part in various consultation. So to kind of move forward, I really urge you to put yourself on mute unless, of course, you are speaking. Just as I did say, it is about recording purpose, but really, I know you all have your own stories to tell, and I know you all have your both personal and professional experience to share, and it will be useful for us to gather that really, both for historical purpose. Soon there'll be a vaccine, and inevitably issues of vaccine have already been discussed, but we do want to know primarily for the point of view of minority communities, and this is why we had a broad range of communities, but really the untold stories in the end have always been issues around race. I know we're too embarrassed to talk about it, but it is important that we do talk about it for the greater good of the public, because in my opinion, hopefully you share that, our lives do matter. So let me just, I suppose kind of like to start the whole process rolling. Well, I mean, please don't take it personally. I'm just going along with kind of what I'm seeing on my screen, really, in terms of the speakers, really. And then I will ask representative organizations and charities to talk, and then I would like representatives of public bodies and mayors, and of course we have a legal expert who will talk about the ramification and challenges in the context of public law, human rights law, international law in the context of COVID. So there is a wealth of knowledge and expertise, and I want you to share that expertise for the greater good of the public. So, I mean, let me just kind of start with, I suppose, Sharina, are you there? Do you want to start briefly introduce yourself, and then we'll talk about things that we'll talk about and what you've seen.
So, hi everyone. Nice to see everyone on a Sunday. So my name's Sharina, and I work for two organisations in Tower Hamlets. The majority of my time is based at Limehouse Project, and I have a part-time role in Toynbee Hall as well. My role in Limehouse Project at the beginning of COVID was I was doing EUSS applications and advising on EUSS, and the exciting job of explaining Brexit to people, and it's been a while since Brexit was our biggest headache. And then halfway through COVID, my role changed and I became a universal credit advisor. It's something I've been doing ongoing anyway, and I have been delivering universal credit workshops in Tower Hamlets and around Tower Hamlets in other boroughs. But now I am helping people with the application process and MRs and appeals and things like that. In Limehouse Project, the majority of our work is welfare benefits, and all the way up to casework. We also were one of the food hubs in Tower Hamlets, so we started distributing food in, I think around April was our first food packages that went out. And I think at that time we just didn't know how long we'll be needing the food hub, to the point where now we've had to move the food hub to a secondary location because of the need of the community, but just how much food we are now having to give out, and the packages we've had to give out, and the space for volunteers and drivers and things like that. So just managing that food hub. So we are in the center of the community. We are delivering a lot of the projects that are primarily affecting people who have been affected by COVID, either by having COVID themselves, or as a repercussions of the economic fallout. So yeah,
Thank you.
not
No,
really a good time.
thank you, Sharina. Oh, Rose, are you there? Rose, do you want to tell about what's going on at your end then?
Hi everybody. My name is Rose Lewis. I am from Sister Space, and we are a specialist domestic abuse, sexual abuse, and domestic violence charity. In terms of COVID, that has had a severe impact on everything that we do. It is just become a standard thing now, COVID actually. It affects and impacts domestic abuse victims and survivors in every way possible, including their families and everybody else around them. It has severely isolated a lot of people who are finding it difficult to navigate. Also, we distribute food. We've been doing that for a few years now, and we have seen a major rise in food distribution. We also have found that poverty, as I say, poverty is real. It really is real. So COVID and poverty do not go very well together at all. And we've got a fantastic team that work at distributing food.
Sorry, Rose, can I jump in? Hi, everyone.
Hi, Ngozi, go ahead.
Right, CEO of Sister Space. And Rose has quite rightly pointed out the difficulties we're having, particularly with COVID and DV. The impact on each other has been massive. But what we also have been dealing with is a borough that doesn't support us, that doesn't see us and doesn't hear us. We've had a lot of trouble. Things are getting better. We've got a lot of support from the community, but what we want to make clear at this point is it's a joint effort, and if we're not all working together, then it's the survivors that are suffering, not us. Sorry, Rose, continue.
No, it's good, but yes, and that has a huge domino effect, as Ngozi just quite rightly pointed out, a huge domino effect. It means that we are working twice as hard.
Absolutely.
We are blessed because we have a lot of support also, but that would have definitely been one of the areas that we are going to speak about also. But really, just to say that in terms of the food banks, for us African heritage people, the food bank is we applaud food banks. We're not saying anything against the food banks, but the food banks don't actually cater for an African Caribbean taste bud, basically. So you get all the standards, which we're thankful for. I have to reiterate that we are very, very thankful for. But for a lot of people, they don't get any of their own foods. A lot of the elderly people, we'll deal with a lot of elderly people. There's no authentic grassroots food that we can get. So they often end up with food that they actually are not going to use and that they don't want, and they don't want to seem ungrateful. So they just take it. So those are just some of just a few little snippets about COVID, food banks, and poverty. But there's a lot more that Ngozi will be speaking about later.
Okay, so thank you, Rose. Ngozi, do you want to add anything else on behalf of sisters?
Yeah, I do. Listen, I'm very happy and very honoured, Ripon, that you invited us onto the platform. It's very rare you see African heritage women having a voice to speak. We find oftentimes many people are speaking on our behalf, thinking that they know about us. They do not. So just to add to what Rose has said, when the lockdown come and they have essential places open, essential for who? Who makes a decision about what's essential? So I know that I have a lot of family here from different cultural backgrounds who will understand exactly what I'm saying. There are people making decisions about us who don't know anything about us, and we need to change that.
Thank you, Ngozi. I know we kind of moved straight into the conversation and we focused on grassroots. So let's focus on that. I know, Rose, you've spoken about it. Sharina has spoken about it, and Ngozi. Emma, what's going on at your end?
Thank you, Ripon, for yet another important meeting, and it's a pleasure to be here with all of you. My name's Emma Mia, and I'm the CEO of the Asian Resource Centre. We're based in Croydon, and our primary purpose is to give a voice to minority ethnic communities, in particular, but not exclusively, the Asian community. So I come from one of the worst affected boroughs of all 32 London boroughs, and we've been recently in the papers for all sorts of reasons, and none of them good, unfortunately. We're the first of in 20 years councils who've submitted a section 114, which means effectively bankrupt during a pandemic. So as you can see, it's a multifaceted problem for Croydon to deal with, and we are finding that the VCS, which is the voluntary and community sector, is having to mobilise in ways that we've never had to do since we've existed 20 years ago. ARCC has published a report of our findings. One is a community report talking about things like food banks, and Rose, you picked up a really important point about cultural foods. So our food bank did recognise that and accommodated for the cultural foods, and that's why we were so unique. We also realised that older people, a lot of them don't cook when they're over 80, so giving fresh ingredients was unhelpful. They wanted cooked meals, something that could sustain them, something that was healthy. So we also supplied cooked meals, and it was an evolving service. We also found that befriending was essential during that time. Loneliness, social isolation, mental health, what is another epidemic, another pandemic about to happen in this country, and we need to think about it. Post-COVID, how we deal with these things. So we did a lot of, we used to, at the peak of it, I guess we did around 300 befriending calls a week to elderly people. And we also realized there was a need for some care packs. These care packs were really information, advice and guidance, because of the 360 people we surveyed, we heard that although there was a lot of information out there, there was a lot of misinformation as well. And there was a lot lost in translation. A lot not for the communities who couldn't speak English and speakers of other languages, and a lot of oral languages as well. So I'm glad I see that Chris Tang is in the meeting today, who's a professor dealing with linguistic issues. So we also started doing care packs of information and basic sanitary goods and things like funeral information, things like estates and insurances. Some people simply were not ready for death. What would they do with family members? You know, there was so much mental tension going on as well. So we did those kind of things. But what I want to talk about with you today is some of the findings from the survey that we did, and it was a comparative survey across the different communities. So it was a comparative survey against the Black community, the white community, and the Asian community. So Rose and Ngozi, I hope you'll find this useful, that we've thought about intersectionality, the commonality, and what makes us unique as communities. So what we did learn when we first started out, we thought this disease, this virus was going to be a leveler. It didn't discriminate against old, young, black, white, but it does. It's not a leveler. It's highlighted a very painful fact about inequalities. And what we've learned is that, minority ethnic groups cannot be aggregated together because we meet important differences, and that's where intersectionality comes in. And it's important for us to understand what the differences are so we can actually give a proper response to respective communities. There's a lot of communication going on, but we need to make sure it's the right communication. There are loads of myths out there that need busting, so ARCC has been doing lots of myth busting work, and I know, Ripon, I haven't got long, so I will conclude quite soon. What I've always been talking, and I've taken it to the highest level that I can, that we need a reform in how we distribute social goods in this country. There is a wealth distribution issue in this country, and COVID may have highlighted things like BLM and others, but it's an existing problem we've had for many, many years. And we as a Black and Asian community have been talking about it, and minority ethnic other communities have been talking about it for a long time. We need to start thinking about those structural inequalities that have led to this. There are individual communities that are worse affected. So if you're a male, you're worse affected. If you're from the Bangladeshi community, you're worse affected. If you're from the Caribbean community and the Bangladeshi community, you probably got less of a financial buffer if you were laid off from a job. So you're affected in that way. We know that the catering industry, for example, and hospitality, the BME groups have not been able to access the government support like other communities. They're affected. So this is a multifaceted problem. And we post-COVID is what we need to start thinking about. I know, Ripon, you did mention to me earlier about the vaccination issue, and we did a survey recently where 53% of people said they would take the vaccine initially, but we had a debate. We brought in the Director of Public Health in Croydon, we brought in clinicians, people who worked in ITU, who could speak to the public, and after that session, almost 70% of people said they would take the vaccine. So there are interventions that can happen, that work, and dialogue is the beginning. I'll stop there for now, Ripon. Thank you.
Thank you, Iman. I always find it fascinating listening to you. Now, I know in the end, COVID is predominantly health issue, but of course the knock-on effect can be many. But let's go back to discussing health issue anyway. Lulu, are you there? Could you just tell us what's going on in the context of health from NHS perspective?
Sure. Well, I work as a project manager at East London, and I come from a perspective of having worked in East London, where there's been obviously COVID deaths, and it's an area of higher Black and Asian minority residents. Also, as patient service user myself, and I have family in Birmingham as well, so I myself come from the South Asian community, and so during this time I've been, the kind of work I've been doing is pulling together a psychological support service, helping with that for the staff members. Outside of that, I've been working with the National Institute of Health Research as a lay reviewer, looking at the BAME research papers that were there, so kind of selecting which ones might need to go through. So that's quite interesting research that should support what we're doing here. And most interestingly and importantly, qualitative interviews with patients across Luton, Bedford, but also East London as well. And as you would expect, the people I interviewed were demographically typical of that area, so a lot of older white people, but also the younger population tended to be Black and Asian. And as many of you have already highlighted, you know, we're all in this storm together, but we're not all in the same boat, and it's just highlighted a lot of inequalities that were already there a long time. So, you know, I guess, you know, it's quite it's quite tiring for many of us who have been sort of working on this for a long, long time to sort of have this come along and kind of raise more of the issues. So in terms of the interviews, the things that I was finding, and you know, I mean, there was a lot of information. Obviously, these were hour-long interviews that were carried out. But I think the things that really struck me were how important neighbourhoods were to each other, and how much communities were really important to each other. Somewhere where there was sustainable housing, people have lived there a long, long time. Even if medically, when they came out, they had a lot worse symptoms or you know, health kind of difficulties, they seem to feel like they could cope better because of neighbours coming to, you know, sort of trim their hedges and kind of gardens they had, or they knew where to kind of get the shops from, and like you were saying about the sort of authentic cultural sensitive foods that were there, they knew where to go for some of these, whereas there's a lot of new housing and new people that have moved in, and they haven't established those roots yet. And you know, I did worry for some people who, because I spoke to not just the people themselves but their carers. Sometimes there were language barriers, and so their families would speak for them. And just I mean, we know it, but the young carers that are there, the kind of 15, 16-year-olds that will be translating, not just for their family member, but also that has been unwell and too unwell to speak, but their mum as well, who may have been new to the country and can't speak English as well. And so, you know, they're the ones that are taking all the phone calls and kind of, you know, helping their parent navigate everything. And that's a lot to take on. And, you know, sometimes the support that's out there, you don't know what you don't know, and they're having to do all of this, and yeah, there's a lot of things that we talk generally about. Some of these nuances that come out are really important. Before I forget, I'm going to say there's where I work, there's a Tackling Food Poverty webinar on Wednesday. This is 16th, isn't it? Yes, that you can sign up for. I'll pass it on to you, Ripon, afterwards if anyone wants to join, because I think that would be quite interesting, and you know, in terms of Tower Hamlets and the ideas that some of you might have about how we can ensure that it is appropriate, how we tackle some of those inequalities together, particularly for food poverty. And yeah, just to echo what some of you have said about the, you know, 0 hours and taxi drivers, restaurant workers, people that are having to go in, they haven't got any choice. And although we've got data and there are differences in terms of who might be impacted, I think there's something about the occupations that people have. You know, some people are more likely to be faced with people around them who have COVID because they work in the healthcare sector, whereas, you know, others are having to go into work, restaurants and taxis and things like that. But there is a lot of information out there, resources like the BME Centre, for example, who and BBC have also done some videos that are in different languages that might help to sort of get information out there in the community. I think that's what's important at the moment now that we've got the vaccines. Yes, there are structural inequalities, you know, bigger issues to deal with, but these have been going on for so long, they're not going to be addressed overnight. What we have got at the moment is something to not make them worse, I guess. So I'll pause there. Thank you.
Thank you, Lulu. Thank you. Okay, clearly we talked about health perspective. We also talked about grassroots organization perspective, where a lot is happening. But now let's move on to local authority, local government. Roxana, I mean, how the central government policy impacted local government? Yeah, I think you're mute.
One sec. Hi there, sorry about that delay. So firstly, can I just thank Ripon, yourself, alongside colleagues that have made some really important contributions so far with regards to the devastating impact that COVID-19 has had on Black, Asian and minority ethnic communities. here in England and across the UK, and no doubt my mere colleague from Hackney, Phil, will also elaborate on the really important work that Hackney and all other London boroughs have been doing with regards to responding to issues of disproportionality, and certainly from the work that we've been doing collaboratively, it has been huge and it has been vast. And please, let no one think leaving this meeting that either myself or Mayor Phil Glanville from Hackney, alongside other colleagues in local London here in the capital, don't underestimate the devastating impact that COVID-19 has had on ethnic minorities. You'll be aware that both Newham and Hackney in the first lockdown were in that cluster of local authorities in the capital where we had the highest number of the highest COVID-19 mortality rate as a consequence of deprivation anywhere in the country, and we were listed as the top 3-4 at that time. Fortunately, through the work that we've done thereafter, we are no longer within that top tier, albeit we're always alert and concerned about issues of pre-existing and long-standing vulnerabilities that relate to inequality, that expose the risks that are facing our communities, and some of them have been well rehearsed in the conversation so far. And in terms of the local government response, it has been vast and it has been exceptional, and it has been effective and agile, rightly, in the context of a global pandemic that no one anticipated or could have foreseen. There will be lots of examination as to whether or not the government from the outset had provided the right resourcing to local government, and there's been long-standing concerns really brought into sharp focus as a consequence of COVID-19 as to the impact that COVID-19 and similar types of viruses will have in communities such as those in Newham and in Hackney, because of issues of profound inequality and also deprivation and poverty. Now, in terms of the council's response, obviously we were tasked with very much developing and demonstrating that agile response on the front line by national government. When the first lockdown occurred, we all moved into a national sort of regime and response in line with what the government was directing from the centre. And I think that's also highlighted some issues that we've been advocating to government that they need to respond to and to improve, and namely ensuring that local government at that very local level, because we know our communities, we work with our communities, are able to respond more effectively in terms of the requirements of COVID-19 in the context of locally based test and trace and support around isolation schemes. In terms of the work that we've done in Newham, we knew from the outset that COVID-19 was going to hit us very hard, both in terms of the health impact but also the economic impact. And we mobilised and worked with our voluntary sector to establish a whole range of what we called Help Newham hubs across all of our community neighbourhoods, which has now transitioned into a Newham hub, where we're working with over 100 voluntary sector organisations from across the range of faith, ethnic and cultural groups. I noted that Rose made reference to how some of the catering that was provided from some of the for residents, vulnerable residents, both in lockdown 1, but also subsequently, wasn't responsive to the different cultural needs of varied communities. But just by way of illustration, in Newham, in that first lockdown, and as we transitioned into the COVID-19 living situation that we've all been challenged with for the best part of the year, we have collectively delivered, with a voluntary sector, 230,000 parcels of support. That includes food, that includes all of those household essentials. We've reached some 16,000 households, and in essence, we've been able to deliver 750 250 tonnes of food into the borough and into community food hubs to support residents. And we know, as mentioned, that we would be hard hit because of deprivation and inequality, and we've got a significant number of households where, due to issues of poverty and inequality, you know, having that basic access to food is a huge deal for them. We are also grappling with a significant number of families with no recourse to public funds, and that's another reason why we've worked diligently and very hard with our voluntary sector to make sure that we've got a you know, response, an appropriate response, which is very much part of our duty of care to all residents of our community, regardless of the status that they may find themselves in. And I wanted to just conclude, and I'm happy to answer further questions during the Q&A session. I noted, Ripon, in your introductory remarks, you made reference to the vaccine, and I know that all of us remain challenged as we end this year. And as no doubt Phil will attest, we are by no means, no stretch of the imagination, into any kind of safety zone at the moment. In fact, the situation in London has become very, very bleak. You may have been noting the media reports over the past week relating to London facing the prospect of being moved into Tier 2 by government. The exponential rise of COVID-19 across the community, where community transmission between particular age groups and young people are a primary area of concern at the moment, has meant that London and North East London, within which Hackney and Newham are in, have seen amongst the highest increases over the last sort of 72 hours in particular. And the prospects of us needing to be really, really careful in our countdown to Christmas remain very high. And I wanted to just add, with regards to that, when you look at the data and and analyse the data around COVID-19 case rates and transmission rates, communities that are being particularly impacted, unsurprisingly, are ethnic minority communities, and within that there's been an exponential rise amongst the South Asian community. So we're going to have to redouble our efforts, work further and deeper with our communities, working in partnership with the voluntary sector in our localities, because we know as local authorities we don't necessarily have that reach, but more importantly we want to be very precise and exacting and effective in what it is that we have to convey, and we can only do that by working with the voluntary sector in our neighbourhoods and at a very, very local level. So I'm going to just pause there. Thank you very much, Ripon.
Thank you. Thank you, Roxana. And Phil, please do kind of let us know from the perspective of Hackney, but also financial implication that's having in Hackney as well.
Thanks, Ripon, and thank you for convening this event. I think it's really important. I'm just going to start, you know, one of the things we've turned a page on in Hackney, hopefully, is talking about BAME communities as a whole. And not thinking about actually what is meant by the different communities that are represented by that kind of 4-letter acronym, because there are so many different parts of this crisis that impact communities in different ways at different times of the crisis. And Hackney, you know, being one of those places that is truly diverse, has all of that. So very early on, it was a question of racism and attacks on the Chinese, Lao, Cambodian and Vietnamese communities. People were uncertain, especially that time going into lockdown, when the streets started to empty and having those businesses feeling incredibly vulnerable. There were also communities that were hit hard as well, and like the rest of the hospitality industry, really challenged. You have the Filipino community, often at the line of our public services and especially the NHS. When we were talking about PPE, much of the PPE that they were forced to wear didn't fit. It wasn't culturally competent. The sizes weren't available. So when big numbers were talked about how much PPE was in the system, if it wasn't usable, and you know, real deep hardship. I think any community that has a large part of their population working in the informal grey economy. So we saw Arab and Somali communities on the Islington-Hackney border, where hospitality effectively, you know, especially people that live tied to their jobs, not eligible for any of the national support. So I think it's just really important that, you know, and you're highlighting the Bengali community, which stretches across all of the boroughs of East London, as well as having home elsewhere in the capital. But it's just really important that we recognise all of those differences within the context of disproportionality across all ethnic minority communities. And most recently, I've spent time last week with the Bengali community and the Turkish, Kurdish and Cypriot communities. I think all of that needs to be sort of understood in the sense of community trauma. And it's been a very top-down crisis, Ripon, I think. And that early stage where the government was essentially ordering the council to do things, the food distribution was not culturally competent, it wasn't necessarily fresh, it wasn't what people wanted or needed, but we just had to get it out of the door. And it also wasn't co-produced, I think, in the way that many of the people that work with the voluntary sector in Hackney, you know, it sort of worked over the top of existing networks and communities. It did the job, in the sense that it meant that those shielding did have access to the most basic of resources. But I think what we learned from that period was the community wanted to do more. They didn't want the council to do it all. They didn't want the council to step away and sort of leave it to the community. So how we've kind of evolved our investment was maintaining our community grants programs, repurposing them, getting involved, very detailed work with HCVS, which is the Council for Voluntary Services here in Hackney, co-producing grants programs with them. So when we got public health funding to develop our own test and trace work, we allocated around a fifth of it to the local voluntary sector to train up community champions to fund grassroots organisations to do that work with communities, rather than saying existing messaging is going to work. And that is sustained into next year. It's a really important plank of what we're doing. And now our food work is co-produced with the Community for Community Partnerships Network, and again doing that grassroots work. So I think it's really important, I think, to us that work can continue, is fundable, and the government understands that it isn't just about resourcing the public sector, but we're able to work with organisations that have suffered a huge amount, communities that have been deeply impacted. And the financial point that I think you want me to sort of talk about and touch on, Ripon, is the government has given councils just enough at each stage of the crisis to say that they funded us to do what they're telling us to do right now. That's the deepest problem, not long-term planning, not planning for the next stage of the crisis, not getting under the surface of some of the systemic issues, just enough to make sure that, you know, we don't see what's happened in Croydon happen to other boroughs and councils across the country. And you can track that, you know, just releasing enough money so that at the end of each quarter, councils can say that they're financially viable. But there is no long-term funding for local government. I think there's a deep fear about what the future holds. And I think if you'd held this event 10 days ago, I might have been filled with a bit more sort of Christmas hope. But the numbers in London are really, really, really bad. They're really bad for the South Asian community. And what happened in Leicester, Greater Manchester and Birmingham hasn't really been seen in that community in London since, I would say, some of the challenges that North West London faced in the summer. And I think what we've got to really work hard on is making sure we're talking to our communities and we're getting that message out. And there's a danger the Christmas message kind of bypasses everybody else that isn't focused on Christmas. And people obviously have the same rights to use the Christmas bubble as Christian and secular communities, but we do need to make sure that there's messages going out are easily understood. I also want to talk about no recourse to public funds very briefly. Hackney took a very clear decision using some of the community insight that the hardship funding provided by the government could not exclude those with no recourse to public funds. So a lot of the welfare systems in local government are built around existing eligibility, whether they're add-ons to the council tax reduction system, so people in that system got that £150 payment, they could access further hardship funds. Well, if you're no recourse to public funds and you can't prove you just lost your job because you shouldn't have had it in the first place in the view of the state, that wasn't going to work. We also didn't want to put people at risk. because obviously claiming things that people aren't entitled to can also damage their immigration long-term prospects. So we created a separate fund using the VCS locally to channel some of that hardship funding, effectively cleansing it so the government couldn't say we were spending money in a way that we're not allowed to do, but investing directly into those communities. No. And the impact of that has been great, actually, in terms of getting people to engage, sorting out underlying immigration status, but also making sure that hardship isn't there. We've done the same with rough sleepers. Everybody in Hackney meant it. And we really, truly believe that you cannot tackle rough sleeping if you don't deal with EU nationals and those with no recourse to public funds. And, you know, like many boroughs, I'm really clear we're not going to cooperate with the Home Office around their criminalisation of rough sleeping again. It's really, really important. There's also that piece around free school meals, and there are lots of campaigns happening around child poverty at the moment. And we have to be really clear that some of the things that we all think are universal benefits are not. And we've made sure that when the government finally released that funding in response to the Marcus Rashford campaign, that we had an answer around free school meals for those with no recourse to public funds. So I'll probably stop there because it's supposed to be a discursive process, but I think we will never always get everything right. We will sometimes feel as remote as the national state, but there's a lot more, I think, that we've learned about this process, especially for the future of public health and health inequality, that it must be co-produced with communities, and we must make sure that we fund directly grassroots organisations and keep them sustained. And I think that's where the power has been kind of unlocked in many of those small packets of funding. But the sustainability of those organisations, I know it is incredibly draining on small leadership teams like Ngozi and Rose and others on this call, because I see that in what they say publicly. And that resilience, we have to think about the long-term resilience of our local voluntary sectors, because there's 6 months of this more to go before the vaccine will have an impact on the communities that we all represent and want to see through the rest of this crisis.
Thank you, Phil. Thank you. Bill Bowring, I know you've got, there's a lot to kind of explore in the context of legal issues, isn't it? Both in terms of human rights, public liabilities. What are your thoughts? I know we looked at politically, we looked at grassroots, we looked at health, but what are the legal ramifications for this? You're on mute. Yep.
Am I unmuted now? Can you hear me? I can't hear you anymore, so...
Can you hear me now?
Yeah, I can.
Go ahead.
Right. I'll just introduce myself. So I teach human rights at Britbanglacovid, and I'm a practicing barrister. I was a councillor in Brixton for 8 years, fighting against Thatcher's cuts, and in the end was prosecuted for willful misconduct and fined £160,000 and banned from holding public office for 5 years. So, and also I have quite a lot to do with the Bengali community, and I appear quite often on Channel S coming out of Walthamstow and TV1 from Forest Road. So anyone who watches those programs may well have seen me on the political discussion programs. So what I want to say is, and I understand I have 7 minutes, so thanks very much to Ripon for the invitation to come on this. Really interesting and uplifting to hear you all. What I want to say briefly is that this country, the United Kingdom, is profoundly hostile to social and economic rights. We absolutely do not recognize them, and that goes quite a long way back. And I'll explain in a minute why that is. For example, in the European space, there's not only the European Convention on Human Rights that this country wants to get out of. Theresa May called it a terrorist charter. But also there's a European Social Charter, and we refuse to ratify the part of the Social Charter which enables collective complaints to be made by NGOs and trade unions to the European Committee for Social Rights. So we won't have any part of that. Many other countries are in it: France, Italy, Greece, and the committee hears complaints, collective complaints, and gives decisions. We are also incredibly hostile to the United Nations on human rights. And just to give you 2 examples, in 2014, the United Nations Special Rapporteur on Housing and Human Rights, Raquel Rolnick, from Brazil came here and was absolutely shocked by what she found, particularly because of the way that social housing and local authority housing has been under attack since 1982. With Thatcher, that's one of the things that we were fighting in Brixton. And her report, very careful report, after talking to a lot of people like you and going all over the country, was that this was a Marxist diatribe. And the government made a formal complaint to the United Nations, which it considers to be a Marxist organization, of course, United Nations. Then last year, you might have heard that Philip Alston, who's the Special Rapporteur on extreme poverty and human rights, came to this country. He probably spoke to some of you. He went all over the country, finding out about what's happened in the past 10 years, where communities have basically been denuded of any kind of social support. He was really shocked. What he said was that the UK's social safety net has been deliberately removed and replaced with a harsh and uncaring ethic. So, and you might have seen the government's reaction again, that they're going to make a formal complaint to the Marxist United Nations because it dares to say anything about housing or extreme poverty. And I'm afraid to say that this is getting worse. And if one wants to look at why this is, I think you have to look at the British Empire and the colonialism, because we now have a prime minister who wishes to channel Winston Churchill. So he is fighting the battle of Britain in the Brexit struggle. And I think we have to remember that Bangladesh in particular, just thinking about Bengal, the British defeated the Bengalis on the 23rd of June, 1757 in the Battle of Plassey. And from then on, you had British rule in Bengal and the whole of the subcontinent. And what we now know is that in 1943, Winston Churchill was responsible for 3 million deaths. So that was genocide in Bengal, deliberate policy of the British government, and in the context of war. So food was taken out of Bengal in the context of British interests in the war. And as I say, 3 million people died. And this has now been, there's now been a lot of research in India and in the United States. And for example, Madhushree Mukherjee has published a big report on this. And so I think one can't get out of the fact that in Britain, why is it that BAME communities are suffering the worst from COVID? Why is it that the deaths are overwhelmingly amongst BAME working in the health services? Just by the by, my partner is a healthcare assistant in our local hospital. I'm working with COVID patients, and practically everyone she works with in the hospital is BAME from the former British colonies. And that's HCAs, nurses, and doctors. So I think one doesn't have to look too far to see why this country has this extremely hostile attitude to social and economic rights and to the United Nations Special Rapporteurs, and refusing to face up to the history of why it is that Britain was in these parts of the world doing what it did. Ripon asked me to say something about public law. Now we have our beloved Home Secretary, Priti Patel, who wastes no time condemning activist lawyers and saying that basically this is a conspiracy of lawyers against the government. And in the same breath, she's condemning judges. And this is because actually the government is constantly breaking the law, particularly in relation to migrants and asylum seekers. We have these deportations, not only of the Windrush, but we have in the Haldane Society of Socialist Lawyers, which I'm the international secretary, we now have teams of lawyers working to stop these deportation flights and going to Yarl's Wood and these appalling centres for maltreatment, and one could say torture, as a matter of fact. And the government's attitude, first of all, of course, the top judges in this country were enemies of the people. You remember the headline in the Daily Mail? So we have a government here which considers lawyers to be activist lawyers, judges who are enemies of the people. But lawyers are not going to give up, as a matter of fact. And we now have a large number of colleagues who are in a hostile environment practice group. We had a big conference on the hostile environment just recently, and they are continuing to find these issues. But in this country, I think we have a duty to make people as aware as possible of what kind of a country we're living in, of the meaning of the empire and of colonialism, and of the hostility of this country, more than any other country in Europe, to social and economic rights. Thank you.
Thank you, Bill. Okay, so how about this now? So obviously, having listened to panel members, I'm sure members of the public have questions around it. Is there any specific questions that you'd like to ask to the members of the panel, or any thoughts that you want to share? Please, if you do, either use the chat section to ask the questions, or just unmute yourself and ask the relevant person directly.
Can you hear me, guys?
Yeah, go ahead.
Okay. Yeah. So hi guys, I'm Tamid. I moved to well, I've been living in Limehouse now over 11 years. I've moved to this country in the United Kingdom at the age of 17, and being Bengali myself, and now British citizen. Actually, you know, I do take a lot of pride on, like, you know, the contribution side. If you look at it, like, you know, what Bengali community as a whole sort of managed to provide. However, you know, obviously, you know, being born and brought up back in Dhaka, I sort of saw in the first hand the emotion and the sentimental side. And, you know, as you sort of grow up, you learn the history and all that. But then you come over here, obviously, for better education for some, and for some sort of better quality of life, and some, you know, just to have that open mind. And for me, going through the whole COVID pandemic and the ignorance that went about it, you know, I'm very much being just, you know, 29 years old, I was very much involved, you know, in the social media side of it. And in there, I actually saw it in firsthand how, you know, ignorant people at first sight was being, you know, there was this sort of blame game to the PPE, and then there's the blame game of the complexion that we carry, you know, just because I'm brown, I'm probably sort of, I don't know, less prone to vitamin D, you know, there's all sorts of things, you know, that pretty much they're out there in the comments. And even if you look at the national newspaper, or even in standards, the comments there, it's shambolic, you know, to live in a society, to even witness it. I mean, I can ask any of the panel there to sort of go and, you know, see for your first hand how sort of disgraceful comments are being made and been left alone. And even in today, like, you know, if a culprit or a criminal of a brown skin sort of does something wrong, the public anger or the opinion that goes around it is very different to, you know, if you have a, like, you know, let's say, a Caucasian person doing it. I mean, we saw that with the moped gang, for an example, you know, all these blames and finger pointing was going around these particular ethnic minorities. But when he saw the big gangs like being caught up, they were a very different picture. And I think that exactly the same logic was being used in, for me, the whole COVID pandemic situation just defines where we are in the society. And, you know, I got to thank Bill specifically, you know, mentioning the point. I think it's very relevant what you said, Bill. It really sort of, you know, goes back to, you know, the history time, and goes to say that where exactly we are. I mean, if you look at it like Tower Hamlets, you know, all this sort of nose turning, face turning that, you know, goes around it. Oh, don't go to, you know, Tower Hamlets, or it's probably the most, I don't know, if you go there, park your car, you know, it's most likely gonna, you know, experience a robbery or, you know, some sort of vandalism. But if you look at the Canary Wharf itself, I mean, how many of Bengali, you know, like, not even Bengali, I'm just gonna say how many BAME populations of offspring that, you know, you will see them, like, sort of, you know, working those top bank jobs? Hardly any. I mean, you know, we always been looked down upon. We always been thrown upon sort of a, you know, the fast barrier and the jobs or the pay security, be that anything, like, you know, there's always that sense of discrimination. And, you know, there's one point I was very, you know, I really took a big note on, and that takes me back to when you had the Prime Minister, last Theresa May, sort of was resigning, and she was just giving this thank you speech. And in there, the things she has done when she started on, the first thing she said, she has initiated this gender pay gap. there is no such a thing called gender pay gap reporting in this country yet. But the second point she made is about the gender pay gap reporting, which she actually did. So, you know, the point I'm trying to make, the ethnic, whenever you're talking about ethnic population, it's always been the political agenda that I'm not racist. But actually, you know, as a society, are we not yet? We are. I mean, even if you look at the management jobs, again, it's very relevant talking about COVID, because one of the point the government was making earlier on, that one of the reasons this, you know, ethnic population, you know, have been very severely impacted because of the type of works they do. But do they? I mean, you know, it takes me back to the Second World War. If you know the history of Second World War, you know.
Tahmin, do you want to round it up? So at least others can have a
sure. Just 1 minute. Sure, thank you. Just 1 quick minute. So, you know, it takes me back to the Second World War. If you look at the history, fighting the fascism. But back even in the Second World War, a man of a different color, non-white, could not get a managerial jobs, even if, you know, as part of the whole, you know, and hard, you know, I meet, you know, everyday work people, and hardly anybody sort of know all this part of history. You know, we fought the, you know, the fascism and all the idea of it. But looking back at even COVID, it was just a mirror image of what's been going on and how quiet the community has been so far. So, you know, it's just a reflection of that. Thank you so much for the time.
That's okay. Does anyone want to respond to this? Maybe Ngotsi wants to say something. I know you left a couple of messages, or anyone wants to say anything? Go ahead.
I'm not going to speak very long. I'm very plain speaking, and I don't see much or anybody on this panel that even looks like me. Yeah, I mean, to me, this is not what I expected it to be. You know, with respect, the mayor of Newham, I heard her giving all kinds of accolades to Hackney and Newham. 100% of our clients have a different story, and the only way we're going to make a difference here is if we open our eyes and listen. Open our eyes and listen to what we're saying. We're saying we feel excluded. Today is a perfect example. The only way change is going to happen, number one, stop calling us names. We're not BAME. We're not Afro-Caribbean, none of these things. And also, within that reference are so many different cultures and so many different people and so many different languages. When you keep lumping us together, it is offensive. It is discriminatory in nature, and it leaves us out. I'm kind of just going to pull out here because I think I'm, you know, with respect, as I said, I'm plain speaking, and I don't know what I'm doing here. I don't.
No, thank you for taking part. Absolutely, your voice matters too, Ngotsi.
Thank you.
Thank you. Your voice matters too. Roxana, you put your hand up.
Just reflecting on the comments just now from the colleague, firstly, just really to be emphatic, no offence meant if any offence and words that I used caused upset. And absolutely, I'm not claiming that the situation in Newham or in Hackney is perfect. I mean, Phil can talk about the Hackney situation, but Phil also eloquently responded to and, you know, has articulated the importance of recognising that communities are unique and they have their unique characteristics, and talked in the language of co-production and co-design and listening and actively listening. And if that wasn't conveyed in the way that I intended, so my apologies and no offence caused. And we know that we've got a lot of work to do, and we're not here to, well, I certainly am not here to stand on a platform to generate platitudes for what we've done. We know that we've got a huge amount, both in terms of challenging the pre-existing system, NHS, Public Health England, you know, the approach of the national government, and where we can, as local government, we are trying to get it right and trying to remedy the issues of structural inefficacy and structural inequality that has led to so many communities of colour being deeply, profoundly impacted. And that, you know, touches on issues of systemic racism that different communities experience in different ways. But, you know, what I'm attempting to convey through what I've just said is that there's an absolute acknowledgement of that, certainly from what I see in Hackney and certainly from what I know is happening in Newham. And it may not be ideal, and I'm not claiming it's ideal, because there's a huge amount of legacy that I'm grappling with as the mayor here, in light of all the things that had happened in the preceding years before I stepped into office. That's not a defence, it's not an excuse, it's an explanation. But, you know, frankly put, I am proud of what we've achieved in the last several months, because I can only begin to fear what would have been the alternative if those approaches that have been adopted by the council weren't put in place in response to COVID-19.
Emma, I think you raised your hand.
Thanks very much. And Ngozi, I completely hear you. And you know, and I wanted to come into this because one of the comments that I forgot to make when I first started, I thought about it and I forgot, was to say it's great to see that it's not only Bangladeshi people in the room today, that it's a cross-section of community. And Ngozi, certainly you being here has made a difference for me to appreciate that it is a cross-section of the community. And as somebody put very eloquently, that we're in the same storm, but we're not in the same boat. You know, and so I just wanted to talk to you about something in Croydon that we've done. So in Croydon, there are 4 infrastructure charities. 4 infrastructure charities recognizing differences. So there's the Asian Resource Centre, which I run. Then there's the BME Centre, which largely works with the Black community. And then there's the CVA that work more with the wider community and mainly the white communities. So there is a recognition that there is a difference, that there is particular needs to particular communities, but we must work together. So for example, in Croydon, what we've done is the BME Forum and the Asian Resource Centre partner in many projects. So we work on long-term conditions projects together, recognising that BME Forum can tap into the Black communities better than we can, and recognising that the Asian Resource Centre understands the Asian community better than the BME Forum. And we're also teaming up on the expert patient programme through the CCG, and we're also working now to bring money into our borough that is deeply, deeply in debt. And we know that the council is cutting money. So what BME Forum and ARCC have done is team together and applied to Comic Relief to become a grant maker so that we can work within those respective communities to bring more money in. So I plead you to look at other boroughs that are trying to do it, you know, in a more cohesive way. And in fact, I've just tweeted out that I was really impressed by Philip Glanville, the Mayor of Hackney, your approach towards a no recourse, because we know in Croydon that was something that wasn't done very well, in fact. But I would say the only way we can continue to understand each other is to talk to each other. So please do stay, if you will, Ngozi.
Thank you.
Phil, I think you wanted to say something.
Yeah, just very brief. The no recourse to public funds position was a bottom-up campaign here to change our approach and really test the boundaries of what you can within a hostile environment. And I think if you talk like Hackney Migrant Centre or Project 17, the people that have been campaigning on these issues for, you know, they would say that Hackney had, if you go back probably 3 or 4 years, some of the behaviours around gatekeeping that they felt when people were approaching children's services, people were very uncomfortable with a Home Office embedded officer. Although we'd done a lot of work to sort of protect communities from that relationship that we needed with the Home Office to get people through the system and to get their rights. But this was a co-produced journey. Sometimes we fell out, and that improved. So, you know, it's about being brave and engaging with those organisations, but also finding officers within the organisation that are willing to show some of that leadership, because, you know, politicians aren't in every room and they shouldn't be. And we've invested, coming out of Windrush, in effectively paralegal support through Practice and others around supporting people through the Windrush crisis, but also using some of the methodologies learned there around our wider work with no recourse to public funds. I think on disproportionality, and, you know, I felt a bit unprepared to come into this room because I don't have as large a Bengali community as others. So a bit like Ngozi might, I wasn't sure whether this was a broad intersectional room or very culturally specific in terms of just looking at the Bengali community, because I know, Ripon, you've done both. And your work at like Toynbee Hall, and I think what Sharina said about the work at Limehouse as well. So, you know, we all serve different communities, but it's just really important as well, you know, to make sure that we haven't overlooked people. And so that's why I also was really pleased to be here. Finally, the flu vaccine is currently rolling out at the moment. We know that there'll be the vaccine around COVID, and we've seen other things like PrEP roll out. Let's be honest, in all of those programs, white middle class people get to the front of the queue because they've read about them. Yeah. They've got their right contact details with the GP. So when the text comes, they're straight down there. If they don't have eligibility, they can go out and buy it themselves. So the flu vaccine obviously has targeted eligibility, but you can also go privately. And I just worry that if we don't get the messaging right, and we don't go further to make sure that as we go down through those categories, care homes, over 80s, 70s, people with long-term conditions, we will lose huge numbers of people. And there's other groups that I'm really concerned about, people with learning difficulties, people that are socially isolated from all communities, because they're frankly really upset, really traumatized, and I think really isolated at the moment. And we're gonna have to go probably door to door in some cases to make sure those people feel comfortable with the vaccine and get the vaccine when they're eligible to do so. Otherwise, they're indoors when it's out there in the world. And all of the mental health and human costs of that to us as a society, you know, we'll be in that public inquiry and going, oh, why didn't they get that? Why did they, you know, and that just won't be good enough.
Thank you, Philip. There was a question actually from Lilu in terms of what can we do to support communities to get their vaccine? So what ideas do we have here?
So we've had conversations, and I've just read the message from Ngozi, and very similar in our community. We've had a lot of myths going around. One of the things we've used in the Bengali community is we've been talking about the findings from the British Medical Islamic Society or something like that. They've given out a statement of making it clear that the vaccine is halal, making it clear that the vaccine is valid and the findings are valid. They've made it clear where you can get more information about what the vaccine actually is and what's in the vaccine and how it's got to the point that it has. And we've been using a lot of this to counteract conversations and making sure, but also more than anything for us ourselves to have an understanding of what this vaccine is, because it helps to make sure they understand that this vaccine, although this vaccine is for COVID, it is not a new vaccine. It's a mutation of other vaccines that they've already come up with. And just talking to people, you know, we have to understand that people have been isolated. They have a very warped idea of what's happened in the world. And I don't know about you guys, but even myself, if I go back to April and when lockdown happened and we weren't allowed outside, I had a very different idea of what was actually happening in the world, because my narrative was very much what I saw on the news and what my friends were telling me. Actually, 6 weeks later when I stepped out, it wasn't as bad as I actually thought it was going to be. So it is that thing of maybe we need to think about how we phrase certain sentences, how we talk about experiences. We need to put a positive spin on it, and then share experiences until someone gets it and they say how easy it is and things like that. I don't think we will be able to take away all the fears.
Thank you. Is there any hand up, by the way, because I might be not seeing all the hands up. So instead of waiting for me to kind of look at you, it's probably better for you to unmute yourself and just say it.
Hi, Ripon. I just quickly wanted to come in on the vaccine. So we've been doing lots and lots of myth busting because, as Sharina said, and Ngozi put in the chat box, there are more people who are convinced probably by the myths going around, which are very detailed, aren't they? And sometimes very, very convincing compared to some of the vaccine promotion stuff, which is not very detailed. It kind of just tells you little bits, and sometimes the other side is more convincing. So we found that using community health champions is a good way of getting into the communities and talking to people in their cultural language and their language, and trying to kind of use community leaders as examples of people who will take the vaccine. But problem is, we're now finding that community leaders themselves are not convinced enough to scapegoat themselves in a way, to say, well, we'll do this, when they actually behind closed doors are not convinced themselves. So we need to have more dialogue with community leaders so they don't feel like they're being scapegoated by the NHS or the government. And we need to be able to, I think, have more dialogue at community level and make sure that the scientists are taking the vaccination themselves. I know plenty of people have said they'd preferably like to see the cabinets, the scientists all taking the vaccination publicly and know that it's safe before they take it. And that's how extreme it is. We really need to make sure that we understand where these attitudes and these behaviors are coming from, rather than just dismissing them as myths and illiterate and uneducated, because that's not necessarily true.
Can I just say very quickly, I'm so happy that you said that. Look, our history of Black people being used as experiments in Africa with the gonorrhea thing, and there's a whole history that we know about. I'm of that generation, so it's not a myth for me. And, Bill spoke earlier about a hostile environment. We've experienced that. So when people just come out with these things, it's not a myth for us, that's a reality. And the wonderful point is, as a community leader, I'm going to go into dialogue for a minute. Me and I tell my people, forgot text me and I text. Yes, that means I'm not going to tell my people to do something I'm not prepared to do. Sure. So until somebody tells me something, so thank you for that.
Fantastic, thank you. Roxana, go ahead.
Thank you very much. Those are really, really profoundly important points that have been expressed relating to the vaccine. And what I would say is this: there's been a consistent, continual feature throughout this whole pandemic, from the outset of the first wave lockdown, where there's been real challenges on part of all the authorities and health partners to convey the importance of public health. And part of that is we're operating in a wider landscape relating to concerns around vaccines, and there's a movement that's has a very strong position about vaccines, i.e. they believe that vaccines shouldn't be taken comprehensively by a population. And I'm making an important distinction from what was discussed by Ngozi and others relating to there's a reality and historical experience of some communities in light of the experience and impact of colonialism and what that led to and the experiments that were undertaken. But there is something profoundly important around, one, treating our communities as intelligent human beings, to not bullshit, forgive my language, to be honest and frank, and to expose them to a process that allows them to ask all the questions that they want. So over recent weeks, we've commenced with that type of conversation amongst our own network of COVID-19 health champions. We, have some eminent academic experts that study vaccines and this type of vaccine, and that understand the epidemiology of COVID-19, coming to speak, and it's kind of like a question and answer, and then we pause, and then we allow people the space. And I also know that there are some serious religious concerns relating to the vaccine, both in terms of the ingredients of the vaccine, whether or not it's religiously compliant, etc., and all of those things will need to be talked through and worked through as part of a deliberate, purposeful, genuine, authentic conversation for information exchange and enabling understanding.
Okay, is there anyone else who would like to perhaps ask questions or need clarity? Go ahead. Or want clarity? Go ahead, Sharina.
The conversation we were having in the morning, I was speaking to a couple of builders, and the conversation we were having is, we've got the vaccine now. Okay, whatever everyone's view is, we have this vaccine right now. And it may be that the BAME community is the community that might resist it the most compared to other communities. I think and I fear what will happen is come February and March, the country will open itself up to normal business, or whatever the new normal business will be. And if our community isn't vaccinated and they're not ready, they will be forced to go into the community and work and go on with normal behavior without being protected, whereas other communities would be ahead of our communities. And that's one of my biggest fear, is when the new normal happens and lockdown restrictions are taken away and people have to go to work and businesses are going to open up, restaurants will be normal again, in whatever sense normal is, what happens then to our community? Because already one of the things I wanted to know is, why did Tower Hamlets have an increase in COVID cases? And we know, our secondary school kids are being blamed for a lot of it. It's not their fault. They had to go to school. It is going around the schools. But also I was wondering, why is it in our community so high? And there were comments being made, well, everyone's going to each other's houses. It must be because the community is spreading it. It's not. We are in the Christmas period, which is one of the busiest periods in some of the businesses that our community works in. So things like the restaurant trade, things like the shopping centers, retail and things like that, our communities work in those trades. Our community is the Uber drivers. Our community are the cleaners and the catering company and things like that. They are being forced to go back to work because there is a demand for that work at the moment. It's not because they're going and socializing and things like that. There's a demand for them to go back into work without any protection and no sign of the vaccination for them at that age range as well. So the concern is, like, they will be forced to go back when things return to a new normal, but they will have no protection.
Thank you. Is there any more? Anyone else want to say anything or respond to what's been said so far?
Yeah. Oh, sorry.
Go ahead, Phil.
No, Lila was in the chat, so I'll let her go.
Go ahead, Lila.
Thanks
Lila,
for that. So yeah, just to echo that, it's one of my biggest concerns, and I honestly don't really know what to do with it. I can see it happening. I can see sort of from now, 5-10 years time, we'll all in 5-10 years time, we'll all be talking about how Black community or Asian community didn't take up the vaccine, that past issues and things that have happened that have eroded that trust. And it's like, yes, we know all this, but what now? What do we do about it? And that's the solution I don't have. We all know, and there are concerns. So is it that we need a public meeting to kind of address some of these issues? Do we need to have people in the room? Who is it that people listen to that might? Someone's sharing the screen there. Who is it that people might listen to get this moving? Because I'd really like to see that. At least what I would like to see is people making an informed choice. That's what's important for me. If people decide after, when they've read the ingredients, they know everything that's on it, they've had their queries answered, that they still say, actually, no thanks, then at least that's an informed choice. But that's my worry, that people haven't got the information. So now pass it back. Oh, one other thing, sorry. Just one other thing, vitamin D. I know that has been a bit of contention, because people say, it's kind of eroding the systematic racism and things. But on a personal note, I hadn't been feeling great recently. I know the normal is meant to be 75 to 220, I think, mmol, and the one that came back for me was 14.8. So consider that. That's and I'd run the Couch to 5K last week. So and I thought I was all healthy. So yeah, I would say, regardless of whether it helps with COVID or not, that aside, just look after yourselves, and any information you can give in languages to your community, however that might be.
Okay, we'll take 3 more questions and 3 more, and then we'll show a video, and then we'll call it a day. So go ahead, Phil. You're the next person.
Sure.
Thanks. I've always had a healthy skepticism for the kind of community leaders methodology for kind of the great and the good, whichever community that you're working with. And I think the work that sort of went on with Doctors of the World, but also I think some amazing GPs that were from the communities concerned made their own films and videos that were contextualized. They weren't flashed. They weren't they weren't people being paraded kind of to do something. They were heartfelt responses from communities. And I know there was a Somali GP, heritage GP from Tower Hamlets that made some really good films. We've been really using a network of Hatzola and GPs from the Haredi community in Hackney and Haringey to make sure that messages that we simply couldn't send were circulating amongst the community, you know, using WhatsApp and using other community channels. So I think it's just really important that there isn't a further top-down approach as we make this next stage. It's about finding the right mix of celebrities or the right mix of leaders, although I think it is important to convince leaders because they are opinion formers. But I think events like this are even better when you've got kind of community members beyond that involved. And actually, the filter can be really damaging because you're putting people that may feel uncomfortable themselves, may not have all of the information to kind of to filter all of those questions. Actually, having the Director of Public Health meeting a large range of people from a community can be a lot better than me doing it or even a community leader doing it. That was all I was going to say. Mayor Fiaz and I have spent quite a lot of time with Mayor Biggs and others over the last week or so. We were thinking about what happened with the crisis the first time and advocating for greater access to the vaccine because we could see what the stats were showing about East London and thinking, you know, if we're going to focus the vaccine on a part of the country that suffered greatly during the first and second waves and where the vaccine could make a real difference for all the economic reasons that have been rehearsed. But, you know, we haven't really seen a sign of that playing through in the way that we would want. But I think it's, you know, access to testing, access to the vaccine, the quality of where that happens and can you access it? You know, do you remember the testing centres that you could only drive to that were on the outskirts of London, which meant inner city London communities could not get there and could not get there safely. So I think we've got to keep pushing this point in all of the rooms that we're in.
Thank you. Go ahead, Emma.
Thanks, Phil, for some of the kind of detail on that. But I recently got asked by somebody that if it is BME populations that are disproportionately affected and all the key work or majority of the key workers in hospitals, etc., are BME, why aren't the BME population running towards the vaccine and getting it if indeed we are disproportionately? I mean, for me, that just shows a complete ignorance of what the real issue is. Who are the policymakers? Who's making the decisions? Yes, BME nurses, BME, there are lots of BME doctors, but who are the policymakers? Who is deciding what happens and what policies get? I think that is what's putting people off, because there aren't enough BME people who are influencers, who are actually decision makers at the highest level. So we get to a certain point and then we stop. And then there's only white communities at the top making the decisions. There has to be surely a better representation of people that look like us, that talk like us, that make decisions for us.
Go ahead, Roxana, and then Nigotsi, and then we'll watch the video.
All right, and thank you very much. I mean, just in response to the comments just made by Emma, so basically there is a escalation framework that has been set by national government, and that was set from the outset of the start of the pandemic, and essentially it is government that determines the national and regional framework response, informed by what comes out of SAGE and what is being advised on part of Public Health England and in the regions. Public Health England in the London region is actually led by Professor Kevin Fenton, who is you know, a black man of colour, really eminent, knows his stuff, really pushes back, and there are voices in London councils of colour at the top that are advocating and making these points at NHS London level as well as elsewhere. And then you've got important voices in the form of, you know, the British Medical Association and other leading Black and Black and ethnic minority professionals in this space. And there is also that input being provided in terms of that critical thinking and appraisal of what the government is doing across academia and across the scientific community. People of colour are inputting on this stuff, and I just really needed to emphasise that. In the context of, you know, the NHS and frontline workers, you know, this has been a constant area of concern, of the fact that disproportionate impact hasn't been sufficiently sort of addressed within the health ecology. And there's been a number of recommendations that the Public Health England assessment and analysis of disproportionate impact on ethnic minority communities have made with regards to how that needs to be responded to. And I know that the various NHS trusts are undertaking the remedial actions that are required. And then I just really wanted to pick up on the vaccine point. In addition, the vaccine in and of itself is not going to be our route to freedom. The chief medical officer, the chief scientific officer, both have said that we are going to require to continue with all of those basic public health messages, maintain space, you know, cleaning our hands, wearing masks for the foreseeable future. The vaccine is not the silver bullet, and we're going to need to continue building on, you know, the evidence that is emerging and becomes known about what is happening within our communities and why there is the inability of that message to cut through. And part of that is because, you know, institutions, bodies aren't hearing, and or they're not speaking in the language, not literally the language, or in a way that is having resonance. And there's much, much more work to be done in that area.
Thank you, Roxana. And Ngotsi, go ahead. I want you to have the last word.
Me?
Yes.
Big respect to everybody here, yeah? But I still think certain people are not listening. You're defending, but not listening. You need to be speaking to people on the ground. I'm telling you, Sister Space, check us out. We're with the community, the whole community, not only the Black community. And I'm telling you, you're not listening. Something's not working, something's not gelling here. And the only way we're going to get through this is if we do it together. So just take some time out, think about what you've heard today. You know, don't underestimate us because we don't seem to be sitting in positions like, I don't know, council. The last thing I'm going to say is, you talk about a Black man who's really good and he's in a good position. You're not getting it. There needs to be more of us in top positions, making decisions about us that affect us, Black women, brown women, every kind of woman. And that's the only way change is going to happen. Enough respect to everybody. Whoosh, Megani.
Oh, I've got a quick question.
And I really
have
do
to
need
ask,
to come back, and I'm really sorry, but
No,
I
don't want it to be a back
really do not, you know,
Please,
I'm
I don't want it to be a back
a
and
bit
forth.
regretful that, you know, what's been said is being interpreted in a way that has been referenced back, and that is not, you know, the case. I am hearing, because I'm understanding those comments
This isn't necessarily at you, Maya. This
and,
is necessarily
you
at you.
know,
Can I say,
in the spirit of
general.
exchange, it would
Don't
be really
take it
helpful.
Ngotsi and Roxana. Yeah,
You know,
so one after another.
you could actively listen. And, you know, I don't disagree with anything that you've said. There absolutely does need to be more people of colour across every single part of the system, in politics, in decision making, in the health sector. I don't disagree. And, you know, I think it is significant that we've got an absolutely brilliant academic who is leading Public Health England in London, the most diverse global city in the world. And do I, you know, accept or agree that there needs to be more? Of course I do. That's the stuff that I've been advocating for years. So, you know, I don't know what it is about, you know, our respective communication styles, but why don't we you know, have a conversation outside of this call. I'm more than happy to discuss the things that we're doing locally, more than happy to discuss the work that you're doing. And I trust me, guarantee you this, there will be more synergies that you and I will be able to identify than what may have manifested in this platform conversation. But I really respect what you've said. Thank you.
Thank you, Nigotsi.
Can I quickly just ask one question about tier 3? It's really important that because we've got 2 mayors in the room, and if you have any influence over our Mayor of London, I want to ask a question that if numbers are rising, why are we waiting till after Christmas to go into tier 3? Why are we not doing it now?
Right, so it's not a determination made by the Mayor of London. As mentioned, there's a national regime that is led by government, and government ultimately determines based on evidence that it gets from Public Health England, the NHS, SAGE primarily, and it will make a decision. It will engage with the Mayor of London, and it will engage with London leaders such as myself and Phil from Hackney and other leaders, and we will articulate and advance the case that London needs to, you know, to be moved into that position, because there is a moral and ethical imperative to save lives. We are here to save lives. We're not here to ignore and turn a blind eye to what's happening around us and to our communities. And that's a position that we've been advocating. In fact, myself and the Mayor of Hackney, Mayor Glanville, you know, have been in meetings, urgent emergency meetings earlier today to make that case. But what we're also saying is that we need to have the resources to support our communities, to help ensure that they're able to isolate with the right money, because as Sharina said, a lot of our residents are working in parts of the economy that, yes, are critical to the London economy, but simply put, because of issues of inequality and deprivation and poverty, they can ill afford to not be working. And if you've got an isolation payment system, which is one, difficult to access, B, incomprehensible in terms of the system and, you know, what's required of you, and C, is really difficult to actually get your application approved, where does that leave sections of our community? They are compelled with a real hard choice, either starve or get food on their tables and pay their bills so they don't become homeless. So we are absolutely advocating for that position, and the government needs to hear us, but ultimately it's the government's decision. And I know that Mayor Glanville may want to say something in addition. Ripon.
Do you want to say something? Then we'll call it a day.
Very, very quickly, I know that takes up time to say those words as well, but what I'd add to what Mayor Fiaz had said is that when we went into tier 2 last time before the lockdown, the government worked with sub-regions to sort of co-produce a response. So basically it was the government, the Mayor of London and London's councils deciding during the course of Monday, Tuesday, Wednesday, Thursday to take the step to go into tier 2 together. The government has pulled all those powers back centrally, and now essentially it is a prime ministerial cabinet decision, not something that's co-produced with any part of the country. And so we were all collectively called in at the end of lockdown and told what our tier would be. Yes, there was obviously evidence, and yes, there was a sort of discussion, and we explored loads of issues, but we don't have that leverage, Ima, that we once had. We you know, and I think the final bit of that is I would expect, without preempting the decisions that are being taken probably while we're speaking, that there will be movement on further restrictions this week. What those finally look like, I don't know. And just Tamid in the chat, I made lots of videos this year to tell communities that I represent that their Eid, their Ramadan, their Rosh Hashanah, their Easter and everything else would be different this year. And I was really nervous about the idea that sort of Christmas got a free pass, because it is the same sort of event that we're talking about, intergenerational families coming together indoors in what are still tier 2 and tier 3 areas. And I think the wrong call was made for possibly the right reason, but I was really worried about those community inequalities that everyone else had been told, no, you couldn't have it. But I know Christmas is broader and it's not just a Christian festival, but you know, it's in the depths of winter. People are going to be forced into indoors. They're traveling all around the country, and I'm not really sure it was the right decision to make.
Any more, or that's it? Well, I must say though, I didn't expect it to be so heated. I'm just glad it is. It shows that you guys genuinely are taking part, and that is much more important than just going through a standard due process. So I do want to thank Sharina. I want to thank Lilu, Ima, obviously Roxana, Phil, and no doubt Bill Bowring. Thank you for attending. But this is kind of our fourth one really we've had, so I'm just really grateful for also all the participants for taking part. So without a doubt, please do enjoy the rest of your weekend, because obviously we have to go back to work tomorrow. So on that note, I would like to say thank you, and we'll call it a day.